Hello, I'm Dr. Jeffrey Curtis from the University of Alabama at Birmingham. I want to talk to you about two abstracts related to use of GLP-1 drugs like tirzepatide. GLP-1 drugs have taken the world by storm as the implications of obesity and its cardiometabolic complications continue to plague the developed world. In an abstract our group at UAB presented using data from the ACR's RISE registry, more than 60,000 rheumatology patients in that registry either are or were treated with GLP-1 drugs. We know that these drugs help people lose weight. People lose generally about 10 to 20%, but what else do they do? In the two abstracts I want to cover, in a cohort of 885 patients with lupus and diabetes, patients were either treated with GLP-1 drugs or SGLT2 inhibitors. They found that both MACE events and lupus nephritis was lower in the GLP-1 exposed patients by about 50%, and mortality was decreased by about 26%. A second and complementary abstract by a different research group but the same data source of electronic health record data studied patients with lupus nephritis, and they found that progression to either diagnosed chronic kidney disease or MACE events was also significantly lower. Both of these are interesting and tell us about the cardiometabolic benefits, including mortality, of GLP-1 drugs. But what I find important and perhaps controversial is what is the extent to which these benefits are mediated by weight loss? Are they treating only excess weight, or is there some inflammatory component that's also being treated by GLP-1 drugs? Assuming that these initial observations hold up with replication, and ideally in a prospective study, we need to understand what mediates the benefit of GLP-1 drugs. Also, there's no off-ramp to these drugs. What happens if people stop? They gain weight back. Does that mean they lose all the protective benefits that I just mentioned? Whether any of these observations, both good when you're on them and perhaps bad if you stop, we just don't know, is going to influence how rheumatologists think about them, and whether rheumatologists are willing to prescribe them as a field remains yet to be seen. But there's no question that this is going to be an expanding field as time progresses.